Hello, and welcome back to the Out of Program podcast. Today, we're joined by Dr. Vernon Bainton, who is the Chief Medical Officer at HavasLynx, a leading healthcare communication agency that sits within the global Havas Health and You network. Hi, Vernon. Welcome to the show.
Hi, Ying.
So, we always begin the show with the same question, which is, what got you into medicine? What were your motivations? How did it all begin?
Right. You want my classic origin story, right? How far are we going back? Um, I didn't have particular plans. I fell into medicine. So I was the youngest of four and was quite academic. I went to a local comprehensive school here in the UK and was nerdy. So I did sciences and maths. And I didn't really have any career advice at that time. I did A levels, and from that was a springboard to go to university, right? So the only career advice I had then was, you've done well at school, or you're going to do well at school. Do you want to be a doctor or a lawyer? And I'd done sciences. I did maths, physics, chemistry, and biology. So being a lawyer meant nothing to me whatsoever. So I went off to Birmingham to study medicine. Truth be told, I always was fascinated with science. As a kid, I wanted to be Jacques Cousteau or David Attenborough. I mean, who wouldn't want to be David Attenborough, right? So I loved biology, I loved chemistry, I loved the natural world, but going off and being a doctor made some sense out of the science that I'd studied. So that's what got me there. But it wasn't through any real plan or aim or objective to be a doctor.
It's it's quite a familiar story because I think certainly in the UK we need to apply for our subjects quite early. Especially when it comes to medicine, because there's a whole raft of work experience and other extracurriculars that we need to fit in order to optimize our applications. Because it is, you know, and it was back then as well. I'm no doubt, highly competitive. But I suppose if you ask any 16-year-old what they want to do with their lives, that's a tough question to answer. And I do think that the American system may have a better system because a lot of their medicine students join, the programs when they're much older.
It's just a conversation between me and you, right? Truth be told, I still don't know what I want to be when I grow up, right? And that part of that, I say that very tongue in cheek, but actually part of that is my drive to do things differently. And that has led me on a very winding, somewhat at times challenging, but different path than traditional medicine would have ever taken me. And it wasn't necessarily by having a plan at the time. So from studying medicine, I took a year out and did pharmacology for an intercalated degree. At the time, it was competitive to get that. And then I qualified and I started working and training to be a hospital physician, and then moved into anaesthetics. And back then, the career pathways were really limited, right? I am that old. So there was academic teaching hospitals, right, which was where I where I started my training. There was community-based district general hospitals, and there was primary care. There was tell of some people that did research, and they were either the professorial academic units within the sort of centers of excellence, or possibly an industry, but nobody really spoke about those people. And so the only career advice was training through those junior doctor years, doing your MRCP or your FRCA, and then going for highly limited places on the career pathway. At that time, my life took a big pivot and a big change due to a host of things, from changes in my personal life, some ill health, some questions I had about what I was doing and why I was doing it. But when you've studied for 6 years and then you've worked for a number of years, you start to realize that you've become a bit institutionalized and actually you don't know any different. You don't know anything about the commercial world or the health ecosystem. Nobody spoke about the health ecosystem back then. So I started exploring potential new roles, and I fell in more through serendipity and bloody mindedness and stubbornness on my part to find new opportunities with three medics, one of which had been an anaesthetist and a venture capitalist. One had been a serial device developer, and the third had worked with the pharmaceutical industry. And their company at the time basically helped doing consultancy for the pharmaceutical industry. And meeting them, they told me something that nobody told me before. They told me I had transferable skills, which was very exciting. But it was like, oh, really? There's somebody who's willing to pay me to do other things. And so I started working with them, and I worked for Janssen Sealag, part of Johnson & Johnson, and Bristol Myers Squibb, field-based medical affairs roles. And they were a hybrid between medical affairs and commercial sales teams, and basically opened up my world to not just the pharmaceutical industry in the UK, but the health ecosystem, from pharma, biotech, devices, software as medical services. I very rapidly realized that there were many other opportunities. One didn't know about them, right? I didn't know about them. So I quickly came to the conclusion that there was an opportunity for me to mix what I actually really love, which is communications, with health innovation and through the pharmaceutical industry. That's my first big change in career.
And before we explore a bit more about that journey in medical communications, I just want to wind it back a little bit and talk about those earlier years. Um, because what you mentioned was that, in pursuing medical education and then becoming a junior doctor, it sounded like there were some personal things, there were some other factors that made you question, whether or not you were on the right path. And then, of course, it sounds like you met some brilliant people that gave you an opportunity. But on that kind of soul searching, can you share a bit more about that? What was going through your head at the time as you were, going through the years as a medical student and a doctor? Were you facing an existential crisis? Were you not enjoying the kind of work that you were doing, or were there other factors at play?
Whole mix of those. And I tell people that have left or had more mixed portfolio careers or have come out of clinical practice. There's a huge amount of social cachet. It's a vocational role. You're taught that you owe the NHS your pound of flesh, and you're trained for a long period of time to work, and you owe it to do that work. I had to reconcile. It took me a number of years to reconcile the facts of the matter that there was aspects of clinical practice that were wonderful, a hugely privileged role, but they weren't for me. And actually, I could apply my training and learning to date in many ways in the health system. And in fact, I could enact change at scale internationally, far greater in some ways than I ever could on an individual clinical basis. Now, we're talking a long time ago, above 2 decades. I've been out of that for 25 years or so. Or just under. But it took me a long time to transition, a long time. So there's personal, social, there's the time and money and effort you've spent investing in what is effectively training to do a job that you feel you need, or you're on. A lot of people, now I talk to them in retrospect, or my peers now feel they're on a treadmill, and they aren't necessarily in control of the choices they're making, especially when you look at workforce planning and restrictions of candidate roles for the number of people that are able to work. And I don't want to get into sort of politics of that just yet, but there are a number of factors that are way out of one's control trying to build a career or plough a career within healthcare within the NHS that's very idiosyncratic to the UK. But at the end of the day, there's a lot of bright young things with lots of skills who want to make a difference in healthcare. But I put that to bed a long time ago, that I could do I could make changes and do good in a health setting using innovation and the application of new treatments and new drugs and new devices in a completely different way to practicing individual clinical practice.
And you mentioned meeting, two colleagues that really put you on the path. How did that come about? Were they friends from, your work, medical school? Like, how did you stumble paths?
Back then, you've got to remember that actually there wasn't the job bulletin boards, there wasn't the social media communities and the networks. So you just had to. I applied for a job with them and started working with them in Salesforce Effectiveness, so training Salesforce from the pharmaceutical industry, and from there realized there was a whole industry around the pharmaceutical, and biotech companies with medical affairs, commercial, sales, R&D, corporate. And suddenly I realized there was actually many other opportunities that I could find my way in the world.
And what was it like making that first decision? Because, you mentioned that it was 2 decades ago. Whilst it's very in vogue now to think about alternative careers, to have portfolio careers, back then it was a bit more old school and it was relatively unheard of. So for you to encounter these individuals, for you to make that leap, how did you deal with that on an emotional level?
um, with great difficulty in some ways. No, so I'd never come across entrepreneurial people before. This company was a small group of three. It was three actually people, but they'd set up business and were very entrepreneurial in the way in which they applied their business skills, their finance skills, and their clinical development and device development skills within in the industry setting. So back, as I say, in the day, there was teaching hospital roles, there was academic positions where you get involved with doing some research whilst doing clinical roles, district general hospitals and primary care, and that was it. So I moved into industry, and my peers at the time thought I'd somewhat turned to the dark side because I was part of industry. It's a very interesting relationship between industry and the health systems because we need not just the universities and the academic centers and coming up with brilliant ideas. We need to turn them into products and services and devices and new medicines, right? And you need the industry to do that. And what I've learned over the years is that is a bit of a sort of a false dichotomy of these, and we actually need to be working in concert together. That's the only way we're going to have sustainable innovations and new medicines and new services entering health services. Um, so it was frowned upon. It was frowned upon at that time. And having spent then a couple of years working in industry, I came to the realization that I could apply learnings and expertise across different therapy areas and, in fact, move out of the pharmaceutical companies into communications. So that was medical education, marketing, early asset commercialization, health policy, market access, pricing, PR. There's a whole world of communicate. The world revolves around communications and being able to engage and um, influence behavior change, right? Whether it's persuading a prescriber, a doctor to prescribe a new medicine, whether it's persuading a payer to pay for a new medicine based on a health economic argument, or a patient to stay on a medicine. All of those require communications, and all of them require communications to get a more rapid, effective adoption of those new tools and services and medicines. Um, so I came to the creative industries, which is a completely new sector for me. Um, so we were within the health setting, so we were only working with pharmaceutical, biotech, and health tech companies, but our closely related agency partners were working in consumer, fast moving consumer environments. So they were doing, big scale advertising for whether it was soft drinks or computers or cars. And what I loved about that was it's exciting and interesting, and it's all about engaging with different audiences at scale. And we can learn from it and apply it in a compliant way in health. And we've seen that transition over the last 20 years where, having much greater activation of patients, of, consumer engagement approaches to people about their health instead of the old um, sort of patriarchal um, system of healthcare where you doffed your cap to the clinicians and I hope they would treat you right. So things have radically changed over the last 20 years. And I navigated that as a career path from there in healthcare. That's what I've been working in healthcare communications.
And from being a doctor to moving into this, three-person startup, how was that transition for you? Because, a lot of doctors, as you mentioned, it's a bit of a conveyor belt. You kind of jump through the hoops. You get very used to a quite unique way of working. And then to suddenly go into a environment where it's far scrappier, the culture is completely different. How did you find that cultural shift?
So I didn't get as much exposure to the small organization, because I had seconded roles within the pharmaceutical industry. So they were within large medical affairs and commercial business units in mental health and oncology. Um, but I saw how they operated. And I started to then learn how large organizations, commercial organizations operate. So I had to learn, project management. I had to learn organizational skills. I had to learn uh, customer relationship skills. Lots of skills that you don't necessarily learn as a doctor. You learn a lot of task-based skills. And what I realized is it's mainly about problem solving. Things often boil down to some problem solving skills. And if you can harness those problem solving skills, you can probably turn to all sorts of different sectors.
And you've had like a long, illustrious career in medical communications. What then brought you to HavasLynx? How did you land to where you are today?
That's a great question. So when I moved into agency life, I realized it's what I wanted to do, but I had to learn the business. So I didn't move in as a scientific or an editorial or a medical role to begin with. I started really junior and I started in client services. They're the backbone of the business. You understand project management, organization, customer service, and the finances, how the business works commercially. Um, and I rose through the ranks there before I then sort of took on scientific and medical leadership roles, and then senior management roles. And I moved from so our world is lots and lots of different agencies, but they basically boil down to some big networks. And I've worked in sort of three of the biggest healthcare communication networks. I describe them as solar systems, like they're solar systems of companies. So I've worked in WPP, I've worked in Publicis, and then I transitioned over to Havas. I was in pure healthcare communications with WPP and within the Sudler organization, before I was then smitten with going to a digital agency to learn large scale digital transformation and innovation. And they had a particular partnership with a pharmaceutical company, which was a digital innovation group that was designed to build digital innovation as well as doing communications. And from there, I then transitioned back into the Havas network, the Havas Health Network within HavasLynx. And I've just served my 10 years here, actually, give or take.
Wow, congratulations.
Yeah, time flies, right?
And then, 10 years in this organization. At any point in your career and your journey throughout medical communications, did you ever think you wanted to go back into clinical?
No,
Why is that?
no, because psychologically it was very important to make a transition and move and forge this career path. And, it hasn't always been easy. Um, at a time over the years, I've accumulated the opportunity to really help other people in this environment. So I head up the science and medical function across our business. We're a number of different agencies that are standalone businesses that are run with their own management team. So I'm part of the senior exec team, and I head up the discipline, our scientific and medical team. So they're either scientists, degree, masters, PhDs, about 54 of them, and a medical affairs team. So they've been healthcare professionals. So over the years, we've had medics, nurses, pharmacists, and we have a smaller team of them. But science is one thing, and clinical trials and evidence base is one thing, and clinical practice is a different beast. And it does help, it massively helps and differentiates us to have people that have been at the front line of clinical practice in different therapy areas and specialities to really understand how evidence or science actually plays out in terms of pathways, clinical practice, implementation, execution, assimilation. Um, and I've been very, very lucky and very, very privileged to be able to launch a number of huge drugs, massively important drugs, whether in the chronic inflammatory disease states or whether in oncology or whether in ophthalmology, respiratory. It goes on and on and on, and not just in the UK, internationally. So in the US, in region Europe, and also in lower middle income countries and BRIC markets as well. So it's given me a huge exposure to health systems in different environments and where and how new medicines or innovations, how do they land, where do they land, and how do you commercialize them effectively, and how do you support patients in those settings? Very different audiences in different markets. That's why that's why I love what I do, and I'm very happy doing what I do, and don't want to be going back to anything.
I think what I was reflecting on is you mentioning right at the start of that, which is, when you mentioned that you needed to commit. And I think that's, a really interesting point because certainly in my own journey, for example, when I was starting, Patchwork Health, I, I held a belief that maybe I could, do both the startup scaling alongside the clinical practice. And what I rapidly realized is that, you're spread too thin. There is something nice about the variety. And, similar to yourself, I really enjoyed, I got a lot out of clinical practice itself, but not maybe, aspects of the hierarchy or of the system that I was operating in. But I realized, as we raised venture capital and, hired employees, that actually I needed to double down on this. And I also shared the belief that you had, which is around the scalability of your efforts. You can have a much more profound impact on, patients, on the healthcare system through startup or through, the corporate role that, that you hold, the communications role that you hold today, than as an individual clinician. And yeah, I think that's a really important point about, sometimes it's a completely different gear change. And to be successful in this, you need to fully commit.
Couldn't agree more. So there's along the way I've come in contact with certain interesting groups like the Clinical Entrepreneur Program, which of course through Professor Tony Young, and that's how we met each other, right? All those years ago, right? 8, 9 years ago, something like that. And I'm a mentor on that program, and that is an entrepreneurial program to help developing HCPs developing their ideas and products and services for not just the NHS, but ultimately to build sustainable businesses. So through the health tech environment, I also see how clinicians and scientists are moving, able to move horizontally far easier now than they ever used to into different roles and setting up businesses or build or scaling businesses that work in the sort of the broader health care setting. And we're awaiting the latest NHS 10-year plans, but when you look at digital optimization, prevention, patient activation and patient support and empowerment, and management of the chronic disease states, right, earlier, all of those things require a massive uplift in engaging with the public out in the community, and not dealing with sick people in hospital, because that is not a sustainable health model, not with an aging population anyway.
And why do you think it's now easier for people, for clinicians now transition into these kind of non-clinical roles? Because, you mentioned that, 20 years ago when you were thinking about this, it was frowned upon, it was uncommon. I would even argue, and I'm slightly younger than you, that even in my time, it was also fairly uncommon as well. What do you think has changed? Just as a little segue.
I think there's been a few things that have changed. I think the success of smaller businesses, I think the success of diversification of service providers within the NHS. The general public think of the NHS as being this, wholly paid for, public service, this crown jewels in the sort of social entity of welfare at a societal level, but actually a significant amount of services are commissioned from a whole host of different vendors. I think there are now many more opportunities to diversify, and it is now normalized to do that. And I think having a portfolio career has been normalized by people of my generation and the following peers. The success of patchwork, dare I say, it's been very successful, but shows people that there are alternative ways to do things within the health system and health, operationalizing healthcare. Whereas I'm sure when you were starting out in med school, you didn't think, I know I need to build a rota system to manage on calls in a hospital setting. That probably wasn't your first thought, right?
No, definitely not. I mean, what I'm taking from what you've just described is that we were the pioneers and provided inspiration for the masses.
Yeah, I think so, and I think there's been a few other factors that have been at play. I think the leveling of salary. Well, I think the plateauing of salaries. I think the limitation of training posts and senior consulting posts. I think COVID changed, and is still we're still dealing with the fallout of COVID in a number of levels. I think socially, societally, and from a occupational perspective, we've just lived through a pandemic, right? And I think that has catalyzed a lot of change. Hybrid working, remote working, people wanting to get some level of balance between what they're doing versus their income versus the impact they can have. And I think all of those factors together have really jump started the change, because we've been talking about a lot of this stuff for a long time, right? But actually, it takes a long time, and the larger a system and more complex a system, the longer it takes to change, right?
And this is going a bit off-piste, but I suppose you mentioned two things that I thought were really interesting, which is that, part of the motivations to explore alternative careers is because of the plateauing of salary and because of the post-COVID, maybe burnout or changing ways of working. Both of which I would say are not the most positive reasons for seeking an alternative career. What I hear from your story is that you were very passionate about the thing that you did, and you could not see yourself going back to, clinical practice because you loved what you do. So I suppose, with that in mind, like, how do you think about these individuals who are now exploring these different paths, and and your feelings about their motivation? Because I suppose a lot of the audience that will be listening will be looking at you and I thinking, well, how can I recreate Vernon's career, or how can I recreate Jing's career? What would you say to that in terms of those kind of motivations?
I think I think it's difficult when you see the truth behind people's choices, right, and their actions. So at the end of the day, people need to reconcile what it is that's driving their change. Dissatisfaction with the working conditions or burnout. The term burnout was first coined in the late 1970s about healthcare workers, right? Um, and now 50, yeah, so a study done in a mental health institution around the impact of working in a setting the way you're overworked and your emotional toll, and it was first used to describe in a healthcare setting. And here we are 50 years later, post COVID, and we've got suicide rates 6 times the general public within healthcare professionals. We still have a culture of silence and considering it weak to talk about mental health challenges and problems. And I think things are a lot better than they were, but gosh, we've still a long way to go. And I think there's a huge amount of not wanting to let down your colleagues and your patients that actually leads people to a situation where they end up ill. Now, going back to your question, what and how do people find their way through this? I wholeheartedly believe in the a notion of serendipity, but serendipity isn't happenstance. It is created. Opportunities are created by connections, communications, asking people questions, being willing to put yourself out there and talk to people and try jobs and take risks and think about things. Um, you listen to these podcasts that say, you need your 5-year plan of reaching X, Y, and Z within 5 years. I think this goal-driven um, approach orientation is problematic. I take a much more systems thinking approach to things, of which outcomes and goals can be part of that. But think about the system in which you're operating and how do you want to be operating. And it's a very different challenge that you have scaling a business and looking to sell it than it is looking to build a career and expertise and domain specialism within a large organization or large, so building specialism and expertise is still hugely important. As long as you can apply technology at the same time, because obviously there's some other factors happening in the markets as well at the moment, and all sectors are being impacted by the advent of AI and other technologies, right? We're all grappling with and learning how to use. But do you want to work? Somebody asked me. Somebody told me a question that you should ask yourself. Do you want to, yeah, basic questions. Do you want to work for yourself or work for somebody else? And I'd never thought about even asking myself that sort of question. And as a youngster now, those are the sorts of questions I would be asking myself. And if I want to work, for somebody else, what sector, is it in commercial sector? Is it in public sector? Is it in charities? Think about those things. Um, and the likelihood is you're probably going to have a career portfolio in this day and age, right?
Hmm. Yeah, that's really insightful. And I'm just reflecting on what you've just described. I suppose you, when I think about your career, in some ways you've traded one vocation for another, because whilst you were a doctor for a number of years, you then went into medical communications, and you've built a long, illustrious career, but you've stayed in this domain and, and climbed the ranks. And we'll talk a little bit about, what it means to be a medical director in a moment. But I suppose to the point that to the advice that you've just given, you've really thought through and built on those skills over, many, many years. And I guess going back to some of the earlier points that I just raised, many clinicians today are looking at those portfolio careers, are looking for, that brand association or exposure, or breadth. But I think what you've demonstrated is that actually you've hard pivoted into something that's an adjacency, but for which you've needed a whole new set of skills, and then you've honed that craft over a series of years. And I don't know if it's a generational thing, but certainly, there is less inclination, I think, in younger generations, even in my generation, to really focus and build that craft over many, many, many years. So I think that's a really great story and path to be able to show people.
I think it's people like Prof. Scott Galloway. You should listen to him, as a marketing professor who's been highly successful. He talks about you only find your passion in life by earning the expertise and earning the respect and pay and responsibility and accountability that comes with putting the time and effort in, right? And I don't think I set out that way, but that's certainly what I found. It's you're as successful in our world as the value you can create and how you're willing to put your, the core competences that we look for. I mean, fundamentally our adaptability, resilience and problem solving. Above every, you can teach a lot of other technical skills and competencies, but fundamentally in our world, it's highly competitive. It's always new. We're only as good as what we created in terms of creative campaigns and communications last week. And next week, we have to do something new. And we might be up against a small company using AI. So we're always pushing boundaries about doing things differently and better. And that suits me down to the ground. It suits my mentality. It suits my attention span. It suits my need and ability to assimilate new things. And science and medicine never stands still. That's what's incredible about it, right? There's always something new to learn, and there's always something new to work on, which I think is incredibly invigorating and exciting, right? But it's not without navigating that turbulence through the way as we see new devices, drugs, services coming through and things. It's all about change, and it's about managing change fundamentally.
And I guess on that topic, you're now in quite a senior role within HavasLynx. You hire a lot of clinicians into your team. So you've kind of mentioned some of the qualities that you look for, but is there anything specific when it comes to the clinicians that you bring on board?
Yeah, so as I said, I have science teams, which are the scientists, and they really understand the data, and they're medical writers fundamentally by background, become sort of strategic in their approach to communications. And then we have complementary healthcare providers. And over the years, we've had a number that have come and gone, and we've had a few brilliant people that have stayed, I'm very pleased to say, some of whom are from the Clinical Entrepreneur Program. So they have, that's a great conduit for us in terms of people that want to leave. And we have a career development path. And we're very, very proud of that. We spend more than £1 million a year on our internal professional development. It's formally accredited. And includes a whole variety of different skills and exposure to learning. But there's a transition that people have to make from going from clinical practice. It's very predictable in terms of your career. It's task-based on a daily basis, fundamentally, and you know where you stand. In our world, we have a lot of structure and rigor around it, but you're as successful as you want to make it. And that really boils down to, do they want to help shape markets, educate healthcare professionals, and launch new products, build brands, and activate patients. If they don't love the communications, it's not going to last. So we've had people come and go, and they've either come to our world as a foray into the commercial world, learn some things, and then go either into the pharma industry or go back into clinical practice. We've had others come to us, perhaps who weren't the right fit because they were looking for an exit to healthcare. And I have to tell people that we're not we don't just pick up anybody who's like trying to exit. We're not an exit strategy from healthcare. That's not what we're about. We're about we're about hiring the best talent in the business to do what we do. So I go again back to that fact that we spend a lot of time and effort on really stewarding and helping develop develop people's professional development pathways that fits them and fits their skill set and their their plan to progress and develop. And sometimes you get that wrong, or they get it wrong.
So it comes down to passion and I guess also as well, a dedication to the role, to the domain. So then with that in mind, how do you view clinicians that may want to, work with Havas from a, in a fractional basis? What's your kind of perspective? Do you hire people on part-time basis?
That's a great question. So sometimes we might, from a consultancy, pay, if there are specific expertise that we need, um, senior clinical experience in a particular domain to help us work in an environment that's very specific. There might be examples of that in rare disease. Certain rare diseases, you need that domain expertise in certain conditions, and certainly in terms of this, clinical development and the types of medicines and the way in which they're used, might require domain expertise. So we might employ people in a part-time basis to do that. Uh, there are roles for clinicians as signatories within the approval process. The pharmaceutical communication sector is highly regulated. We're not on TV advertising drugs to the general public because it's illegal in most countries, apart from in the US and in New Zealand. So you can't actually do that. And we're a highly regulated environment in which we have to be fair and balanced, and we have to evidence any claims that we make. Um, so there are freelance roles where you can be a signatory to sign off and approve content from a regulatory perspective, and sometimes we work with those partners that also freelance the pharmaceutical industry. But what we like to do is have a small number of in-house healthcare professionals that are really expert in our world, and they help in terms of stakeholders. They're great interfaces then for the medical affairs teams within our clients, right? So they can understand exactly what the clinical development pathway and the evidence generation is, but they can also understand what our creative teams and our media teams are trying to do, and our social teams are trying to do, actually engaging with, you know, prescribers out there in the real world. So it's a hugely complementary role that goes along with our, not just the scientists, but our communication strategists and our planners around the campaigns and communications, and the creative teams and the designers. So the practical application and meaningful content is key, right? We've lost a lot of trust in large institutions in the last 20 years for good reasons in some cases, and for the vacuum has been filled with a lot of other people, and there's in the well-being space and all of these other environments. We have to stick to our guns of being compliant, and we're it's really important for our clients to trust that we can make content that's approvable. And so we have to navigate that very carefully because we want to do exciting new things, but there are rules in place for good reason, right? Because we're not selling shoes. We're working with medicines, and there's safety issues and data protection issues and lots of other issues around agency and the rules around how and who we can communicate to.
Mhm. No, that makes a lot of sense. And I suppose what you're saying there is that in terms of the people that you bring on board, it's very, subjective to the kind of work that they're doing. You have core team members, but then you will bring in certain experts, in various different parts of the projects to offer, very focused and specific, expertise. So I have one last question, um, which is just around, and I think we probably touched upon this, but just I'd be curious to kind of know what kind of practical advice you would give to clinicians that are considering leaving traditional medicine or pursuing these kind of portfolio careers. What would you say is important for them to think about?
I think there's a number of aspects to that. I think it's build your network, speak to people, try and learn as much as you can about what opportunities might or might not provide. And some of them might be just learning, but a dead end. Others might open you up to broader opportunities, whether it's business startup or long-term careers in a new sector. Be curious, stay curious, right? Keep your eyes and ears open, and realize that the UK is the NHS is a large, complex organisation, one of the largest in health system terms, but it's one market and one country. So there's many countries in Europe and further afield, and health is fundamentally critical. If COVID taught us nothing, there is no economy without health within society, right? So every health system needs communication, activeness, and people need championing. Met needs need dealing with. New devices, new medicines, new software as medical services are only as good as their ability to be implemented, be executed, and be used and be paid for within the health system.
That's great. And what I also really liked about what you described as well was that serendipity, that we need to create an environment by which, opportunities emerge. And then importantly, we have to take it and we have to, commit. And I think what you've shown in your career is that if you commit and build a vocation, you can get very far. So that's all the time we have for today. Thank you so much, Vernon, for joining me. Um, I assume that, for clinicians that are interested in medical communications, it sounds like, you do, hire a lot of them. So how should they get in touch with you?
Get in touch, LinkedIn, email me, give me a call, social media. Yeah, we're not going anywhere. And I'm always interested in connecting with interesting people doing good stuff and wanting to do good stuff in healthcare.
Brilliant. So for those listening, if you like what you hear and want to support the show, please do like and subscribe to us on Apple Podcasts, Spotify, YouTube, or whatever podcasting platform that you currently listen to us on. It'd mean a lot to me, and it would really help spread the message to others that are looking to explore alternative paths. Thank you, and see you next time.